friends, today's video is about the DIC and the thrombosis. Competency that will be covered in this video is discuss the physiological basis of treatment of DIC and the thrombosis. First we will go with the DIC. DIC refers to disseminated intravascular coagulation. We look at the definition. It is a clinico-pathological syndrome in which there is widespread intravascular coagulation that occurs due to procoagulants that are introduced into or produced by blood circulation. The definition seems to be confusing, but I will make it very simple. Just see here. We know that there is excess of coagulation that is happening within the blood vessels and it is widespreading. This is due to introduction of the procoagulants or the production of the procoagulants by the blood circulation itself. Both are the possibilities that is causing the excess of coagulation. And this is also called as consumption coagulopathy or the defibrillation syndrome. Why we will call it as consumption coagulopathy? There is reason is that the overutilization of the clotting factors and the platelets is the reason why we call it as consumption coagulopathy. And in this disease there is procoagulant activity that overcomes the anticoagulant mechanism. So there is excess of clotting happening within the blood vessels. What are the common causes of DIC? Septic abortions, amniotic fluid embolism, gram-negative septicemia, fungemia, severe trauma, severe eclampsia, burns and snake bite, for example Russell viper, hemolytic transfusion reactions. These fungemia, septicemia, these are related to blood. Fungemia refers to presence of different types of fungi within the bloodstream. And pathophysiology, we will move to the pathophysiology of the DIC. We know that there is excess of coagulation happening. What are the pathways for the coagulation? Extrinsic coagulation pathway and the intrinsic coagulation pathway. We know that tissue thromboplastin is required for the extrinsic coagulation pathway. What are the source of the tissue thromboplastin? Why it is present within our bloodstream? There might be a tissue injury or the sepsis. Sepsis might happen in gram-negative and other infections, and tissue injury that may be due to obstetrical complications, malignant neoplasia, massive trauma, burns and the surgery. And platelet aggregation can activate the intrinsic coagulation pathway. That may be the platelet aggregation may be due to the endothelial injury that happened because of aortic aneurysm, hemolytic uremic syndrome, severe burns and acute glomerulonephritis. These might be the possible causes of the endothelial injury. Now we know that there is occurrence of excessive of intravascular coagulation, and what are the things that happens due to this clotting mechanism and which consuming the excess of the platelets and the clotting factors. There is bleeding that is due to consumption of clotting factors and the platelets, and the activation of the plasmin, that is fibrinolysis process. We know that there is formation of the clot, and this clot itself activates the anticoagulant mechanism, and there is degradation of the fibrin that leads to the fibrin degradation products, and these inhibit the platelet aggregation and thrombin production and the fibrin polymerization. And we know that there will be smaller clots. These are causing the microvascular occlusion that leads to microangiopathic hemolytic anemia and the ischemic injury. DIC is manifested as multi-organ dysfunction and there is excessive of bleeding. There is microembolism which is causing the multi-organ dysfunctions. How we are going to diagnose the DIC? By demonstrating the FDP in the urine. As we know, fibrin degradation product, these are present within the urine in DIC, and decreased concentration of coagulation factors. As we know, this DIC is also called as consumption coagulopathy. The treatment is that elimination of the precipitating factors and replacing of factors and platelets, and blood component therapy in case of excessive bleeding. So whenever there is excessive bleeding that is caused due to DIC, we can transfuse some part of the blood. Now next disease, that is thrombosis. Thrombosis is very simple. It's an intravascular clot. What are the predisposing factors? There are mainly three, and we call combining them as Virchow's triad. The first one is endothelial injury, abnormal blood flow is the second, hypercoagulability is the third one. Then what are the causes for the endothelial injury? That may be due to hypercholesterolemia and the inflammation. There are many causes. I am writing the important ones. And abnormal blood flow, that may be in cases of stasis, for example atrial fibrillation and bed rest of the patient, and might be due to the turbulence that causing the abnormal blood flow. Atherosclerotic vessel narrowing, whenever there is vessel narrowing, for example here there is atherosclerotic plaque, that leads to the abnormal blood flow causing turbulence. And hypercoagulability, that is the inherited, that may be factor V laden, and the acquired, that may be due to disseminated cancer. These three predisposing factors are interrelated. Whenever there is endothelial injury, that causes the abnormal blood flow. If there is abnormal blood flow due to any other cause, that may cause endothelial injury. And this abnormal blood flow may lead to the hypercoagulability, that is due to activation of the clotting mechanism. And whenever there is endothelial injury, that automatically activates the clotting mechanism. Both these cases leads to the hypercoagulability state. Then how we are going to treat this? This is also simple. Prophylactic anticoagulant and antiplatelet therapy, which prevents the complications of the thrombosis. This was the end of the video. Thanks for watching video completely. If you have any doubt, please drop down them in the comment box. Stay well, study well.